Good morning. Time for our Fox 4 House Call with Dr. Andy. And breast cancer is a topic that we've been talking about a lot lately. There's new methods to detect it, and one that's been getting some buzz is the Halo. It's a brand new device, but it's a lot of hype. So is it worth it? Is it that good? Does it have the potential to be that good? Kind of break it down for us.
Well, it certainly has the potential. Breast cancer affects hundreds of thousands of women every year, and it kills over 40,000 women just in the United States each year. So any test that we can find that will help us diagnose women earlier and treat them earlier to save their lives, of course, we'd love to have it.
Right.
The breast pap, actually, it's not a new test. It's actually an old technology, the same that's used for pap smears for women for cervical cancer.
Okay.
Originally approved in 2002, and it basically just tries to excrete or tries to use suction to remove fluid from the women's breast that is then sent to the lab to be checked for precancerous cells.
Sounds kind of painful.
Well, I've been told that it's not painful. So, but they use gentle suction and warmth to do it. But the problem with the test is not actually the comfort level; it's what to do with the results, and that's my problem with the test. That's why I'm not currently recommending it the way it is being advertised.
Okay. Are the results not as accurate as, say, a mammogram, which is the standard test for women right now?
Well, that's a great question. The problem is we don't know. There have
Okay.
been no studies that have been done to show the sensitivity or the specificity or how we can trust the results. The American College of Obstetrics and Gynecology has no recommendation. The American Cancer Society has no recommendation because basically, since it's not a new technology, the FDA doesn't put it through the same requirements that it would a new technology or new device. It's being basically touted for women 25 years of age and older, that all women should get it. That's from the product manufacturer and from one local OB group that's offering it.
Okay.
The problem is that young women are much less likely to have breast cancer. So if you get a positive test, your question hits it right on the nose. What do you do with the results? Do you know?
Yeah, I'd be scared if I got a positive result. I'd be really worried.
I would too. So what we really need to do is have better guidelines first as to what we're going to do with the results and who should be getting tested.
Okay, now if it's recommended for women that are younger, and we know the mammogram isn't until you're like 40.
Right.
Should you take in family history, like if your mom or grandma has breast cancer, maybe then you go get this test?
Absolutely. Personally, I'm recommending this test only if someone has a higher risk factors for breast cancer, such as medical history or family history. Unfortunately, and again, the recommendations to get this for younger women that we mentioned earlier, those aren't recommendations by anybody other than the company that makes the test. So these are not recommendations in the general medical community.
It is an option that is out there. Always good to talk with your doctor, have
Definitely.
that conversation. If you have any questions about this new device or you want to have any other medical questions for Dr. Andy, give him a buzz at 694-6246, info@drandy.us. We're always happy to have your questions. Maybe it can be a segment on the show. Lots of people might have that question.
Yep.
Happy holidays and
Same to you.
have a great week, Dr. Andy.